First this morning, on a more serious note, we all face challenges in our lifetime. Some are born with debilitating diseases, while others sustain a life-threatening injury. Boulder, Neurosurgical, and Spine Associates help their patients put the broken pieces of their lives back together. Boulder Neurosurgical and Spine Associations is a world-class practice comprised of experts dually trained in both neurosurgery and orthopedic spine conditions. We're going to hear from two of their patients who turned to BNA for resolutions to their health needs. And I am delighted today to welcome first-time guest, Dr. Alan Villavicencio. Dr. V, as his patients like to call him, and probably I'll call him that throughout the morning. He's the senior practicing partner at Boulder Neurosurgical and Spine Associates, and Dr. Sharad Rajpal, also a practicing partner at Boulder Neurosurgical and Spine Associations. And it's nice to see you guys.
Thank you.
Thank you for having us.
Yeah, welcome to the show. You know, one thing I found kind of doing some research about you guys, you are very different. You have a reputation of being unique spine practice, and you have many distinctions that really set you apart from others in the community and worldwide. Why don't you name some of those for me, Dr. V?
Wow, thank you very much for that introduction, Denise. That was wonderful. Let me tell you, there's a number of different things that set us apart from other practices. Number one, as you mentioned, we have dual training in both neurosurgical and orthopedic spine surgery, so we can really take advantage of the most advantageous aspects of both fields. Another thing is that BNA surgeons are really not content with just practicing surgery the way we learned it in training. We actually push the field. We do extensive amount of research and have literally written the book on a number of different techniques. For example, we were the first in the world to publish on outpatient anterior cervical discectomy and fusion, and that's just fancy words for basically neck surgery on an outpatient basis. What really patients would be hospitalized for days and sometimes even weeks, we can do on an outpatient basis. Takes us 45 minutes to an hour, and people are home in a couple hours. Another thing is that we have made a huge effort to bring the best technology from all over the world. We have the only intraoperative MRI system in the 4-state area. We brought the CyberKnife radiosurgical system to Colorado, among a number of other different devices and technologies.
We are so lucky to have that here, right in our own backyard. What minimally invasive procedures do you perform, and tell me the benefits?
Our surgeons perform a very wide variety of surgeries that range all the way from total spinal reconstruction from the head to the sacrum. But we've really made a special effort to develop the most innovative and least invasive surgical techniques that allow patients to get back to their normal function as quickly as possible, such as microendoscopic laser spine surgery.
And is it true, BNA Associates, you have an extensive expertise in laser spine surgery?
We do. In fact, we've published more than anybody in the area on, and recently have given talks at national meetings on laser spine surgery, and have really, again, going back to the research, have done an extensive amount of research and use the most advanced CO2-based laser system that was developed by MIT researchers that allow us to obliterate tissues such as scar tissue, herniated discs, and tumors while minimizing the risk of injury to adjacent healthy structures like nerves and other things.
You have made a lot of people happy, including one of your patients, Dawn Elder. She wanted to share her story with us.
I have had spinal issues most of my adult life. I'm also a triathlete. About 6 years ago, got to the point where the pain was excruciating. I couldn't run, I couldn't ride my bike, I couldn't swim, and I was seeking out medical care. I was getting injections on a regular basis, and my biggest concern with having a spinal fusion is what I had been told by many doctors was that I would never run again. And for me, that was taking my life away from me. When I came and consulted with V the first time, with Dr. Villavicencio the first time, he looked at me like I was crazy when I was crying, saying, "But if you do a fusion, I'll never run again." And he went, "What do you mean you'll never run again? You'll be running again." So I had surgery, and I had a spinal fusion. I flew up on a Friday and spent the weekend with my husband. I had surgery on Monday. I walked to physical therapy about 3 miles, round trip. on Wednesday and flew home on Friday. I was able to get back to my regular lifestyle, taking care of my children, and I was able to compete in the Ironman Arizona about 18 months after surgery, where I had a 6th place finish and had a 20-minute personal record. And I'm able to do everything I was scared I wouldn't be able to do and more.
Dr. V, how do you determine what procedures are best for your patient, and how do our viewers find out more?
Well, we have such a wide variety of treatments. We really treat patients on a case-by-case basis. Dawn's case is a perfect example of an elite athlete who really wanted to get back to action as quickly as possible. So the minimally invasive techniques are perfect for her. But on the other hand, I knew that she would really stress the system, so I needed something very structurally sound. So I found a technique and actually developed it myself to treat her, and it worked out perfectly. She actually had the surgery. 3 months later, she was 6th in the nation for a 10K swim, which is 6.5 miles. 6 months later, she completed the Austin 70.3 half Ironman. In less than a year, she did, as she mentioned, the Ironman Arizona. Less than a year after her surgery, and had the best race of her life, and nearly qualified for the World Championships literally within a couple of minutes. And these techniques are not just for elite athletes. These are exactly the same principles apply to the 90-year-old woman who you don't want her laid up in bed for 3-6 months with a surgery. You want her to come in, have surgery, 45 minutes, be up walking the same day, and be out of the hospital the same day and on her way.
Let's talk about osteoporosis, because I understand people with osteoporosis are prone to spine compression fractures, and falls right around the corner. There's possible slip and falls. Can a slip and fall actually cause a spine compression?
I'll let Dr. Rajpal comment on that.
Yeah, that's a great point with the season changing. Osteoporosis is unfortunately a pretty big epidemic problem for people in society. There's about 750,000 compression fractures per year in the U.S. and the prevalence is about 45% in people over the age of 65. So one of the most common problems that we see is compression fractures, especially with osteoporosis, which is a condition where you have thinning of the spine. Unfortunately, when people suffer from these conditions, they have acute onset of back pain, typically focal back pain, worse with movement. And unfortunately, a lot of people attribute that to normal back pain, and it may just be a compression fracture in their back.
Well, what are the options if someone has a compression fracture, and does everyone need surgical intervention?
They don't all need surgical intervention. There's 2 types of categories. Typically, we do a conservative management versus a surgical option for people. And the conservative management is typically a bracing, a medication, or a bed rest type thing for patients. What you're really trying to do is sort of minimize the micromotion of the trauma that they've suffered to sort of reduce the pain that they're suffering from. But unfortunately, in an osteoporotic type condition, what you're actually doing is making the overall condition worse by leaving in bed rest. So one of the nice things that we offer is a minimally invasive type technique where we're able to do a surgical procedure which involves both restoring the patient's anatomy and injecting cement to help sort of solidify that fracture. And the technology has advanced quite a bit over the last 5 years for this. We can do something called a kyphoplasty or a vertebroplasty, and those are the type procedures. And we do this with much improved patient safety, good outcomes, and with fairly low risk.
Interesting. What's the recovery time?
Well, typically it's amazing. You see people that get the procedure done from us and they can wake up immediately in the recovery room without any pain. But I think the best thing would be to hear about it from one of our patients that we've treated.
All right, let's take a listen.
About 2 years ago, I was caught in a horse stampede. About 200 head of horses, we were lunging up a steep gully. Good news, I lived through it. Bad news, I got a really bad compression fracture in one of my thoracic vertebrae. I knew about Dr. Villavicencio, and I knew I could trust him to operate on my spine. They guided me through the preoperative part, showed me exactly what was going on with my MRI, told me they could fix it with an outpatient kyphoplasty. What I didn't realize was that immediately after surgery I'd be totally out of pain. I got off the gurney and went, I'm fine. And I was almost immediately able to pick my life right back up. I was back at my office the next day and skiing and biking and golfing and even riding in no time. I was so relieved to find that I could pick my life up again right where it left off.
Excellent. Dr. Rajpal, you have 3 upcoming open forum community lectures for our viewers to learn more about this.
Yeah, we're offering 3 community lectures, which are free, of course, to the public. And the first one is going to be next Tuesday, October 26th, and that's going to be located at the Lake House at 10600 Westminster Boulevard in Westminster, Colorado. The next one will be on November 4th at the Ames Event Center in Greeley, Colorado. And the last one will be November 9th in Aurora, Colorado at the Summit Event Center. And these will all be typically between the hours of 6 and 7 p.m. It'll be a lecture offered by a forum for patients and people in the community to ask questions.
Very good, and I suggest you go ahead and take advantage of it. It's free, and you can go into more depth with these great doctors. Thank you very much.
Thank you.
Nice
Thank you.
meeting both of you. Again, Boulder Neurosurgical and Spine Associates team of board-certified physicians, dually trained in both neurosurgery and orthopedic spine conditions, is committed to providing quality, innovation, evidence-based practice, and patient-centered care, enabling reduced patient risks in even the most challenging surgical cases. Their number, 303-938-5700, 303-938-5700. You can check out their website at bnasurg.com. BNA is offering 3 free open forum community lectures on minimally invasive treatments for the spine, including neck pain and back pain. Now, each will take place from 6 to 7 p.m. The first will take place again on Tuesday, October 26th at the Lake House, and that's in Westminster. And the second will take place on Thursday, November 4th at the Ames Event Center in Greeley. And then they have the third one that's going to take place on Tuesday, November 9th at the Summit Event Center in Aurora. If you'd like more information, please call this number. It's 303-938-5700. You can also visit their website at bnasurg.com. And the Boulder Neurosurgical and Spine Associates paid for this segment.